Namaste and thank you very much for joining for this video. My name is Natalia Fata and today's video will be about stabilizing and mobilizing the SI joint. This joint is very sensitive, but at the same time is one of the hardest joints, and its main function is to distribute the mechanical energy of the body. So it is not designed very much to move, glide or slide or rotate. It is more of stabilization. But because we sometimes happen to have injuries like falling on the buttocks or falling on the lower back, or making a sudden movement like with a twist, or excessively stretching the hip joints or hip flexors, where the pelvic bones, one pelvic bone most of the time goes extremely to the front and another one to the back. This creates imbalance and destabilization of SI joint. So first thing, we will need either a tennis ball, either a massage ball, or any kind of a hard ball to show you where exactly the SI joint is. So this is the spine, the pelvis, and this is like the area where it is connected. And if the pain is somewhere nearby here, going around the glute here, this is most of the time not only lower back, however it could be herniated disc, but most of the time it could be. And what are the symptoms of destabilized or unbalanced SI, sacroiliac joint, is when you experience pain which is mimicking like a lower back pain. So you experience lots of discomforts around the glute area, around your buttocks, maybe side body, and even the pain may go even to the inner groin. Sometimes it can go outside of the thigh toward the knees. Lower back, SI joint, sacroiliac joint, and the hip joint, they are pretty much the same and involve the same group of muscles. And it is very important to identify which is unstable, which is causing the problem, which is causing the pain. So in this particular video, I will give practices for mobilization and then stabilization of your sacroiliac joint. Because if one of the sides of the joints, where we understand that its two pelvic bones are connected to the spine, to the sacrum, if one is unbalanced, the other one will be kind of creating the tension. So it is important to remove the tension, right, in the area or contraction with the group of muscles that is around there and stabilizing it. And then strengthen the weakest part, which is overstretched or destabilized. So it's a two-way process and may take some time. So what we do first with the mobilization, you put the ball right, not on the top, around this area, and our main target is to release, kind of roll up first, like lie down on it and let the body go into it, and then we can do a little bit of soft movements like rolling and maybe moving in different directions to see how the body is feeling. So lie down on your back, you can lift the pelvis, place the ball. In the beginning, just very micro, very mini movements, right, left, back, forward, maybe doing a bit of circles, again based on your sensations. There is no need to rush to one side, to another side. You can also play with the knees to one side, to another side. What is causing this discomfort is weakness, and when you experience this injury with SI joint, you will notice that the glute muscle on that particular side will be weaker, or maybe even very much contracted. So what we're doing playing with the ball is we're releasing the tension around it. So give your body a little bit like from one side, then you can change, see how you feel on the other side, because both sides are very different all the time. You can also observe if the patterns of how you're walking, like if one foot is more to the other side or the other foot is to the other side, so it also creates a little bit of imbalance. So this is one thing what you do. Most of the time the pelvis gets destabilized when we walk, right? Because if we're walking, one side of the pelvis goes forward, another one goes back, right? So here we will try to mimic kind of movements of the walking step. So first one, you're gonna making sure that your lower back and your pelvis is not lifting or like moving at all. So stabilizing your lower back, your spine. You're gonna work on bringing the knee toward the chest and feel it, right? So when we walk, our pelvis will be unstable, but when we lie down and bring the knee toward the chest, it's kind of mimicking a wide step. So walk here, make sure that the pelvis is fully and lower back is laying down. You can roll up again a little bit to one side. If that is comfortable, you can even maybe take the foot, right? Grab the heel. And again, remember, without lifting the pelvis, stay maybe here. If it's too much and excessive, you can always bend that knee and play in here. And here you can do a little bit of the repetitions if the leg's straight or the left knee bent. So bringing here, exhale, inhale, bringing back, exhale. So kind of you're stepping and making one big step. And then do the same thing on the other side. Okay, so if you feel already comfortable here, so we don't bring the knee toward the chest. We try to bring the knee more into the armpit. So it also stretches the inner groins and as well hamstrings. If you want to go excessive, you can grab the heel and work with pushing the knee back again, but remembering that the pelvis is not moving. Lower back and the whole spine lies firmly on the ground. Very good. Again, to mobilize your right and left side of the SI of your pelvis, we're going to do the same thing as we did the wide step. So bringing the right knee toward your chest, holding it to the chest, and again as you inhale, lifting your pelvis up, maybe here, maybe up there, but here you have to engage your glute area, and again slowly coming down, again evenly distributing and laying pelvis on the floor. Inhale, exhale, lift the chest, not the chest, the pelvis up. And again, slowly go down. Do like 10-15 repetitions on one side. And then slowly coming down and repeat and do the same thing on the other side. So again, press left knee toward the chest, right foot standing on the ground. So on your inhale, rolling in and lifting pelvis up. Again, you're standing on the shoulders, body is relaxed. The movement is happening by engaging your glutes, your hamstrings, and engaging your standing leg. But your pelvis at all times is even. It's not swaying like a boat on the water. Again, do 10-15 repetitions on that side. Very good. Then what you can do, you can slowly, by maybe keeping your feet hip distance wide, keeping your knees parallel to each other, working on lifting the pelvis as if you're lifting every centimeter at a time. Again, making sure that the pelvis is not moving, maybe here. And when you exhale, vertebra by vertebra, laying down with the belly vacuumed in and release. So coccyx kind of moving, we call it pelvic watch. So moving the coccyx down, again pressing two sitting bones to the floor, lifting the lower back. As you exhale, rolling in, pressing the lower back, low ribs to the floor, lifting your buttocks, lifting the pelvis, and lifting the whole lower body, coming on the shoulders, but again, making sure that the pelvis is not rotated. And again, same way, centimeter by centimeter, you're going down stretching. And when you touch, make sure you touch pelvis, not on the right side, not on the left side, both sides evenly. Then you roll, lift the lower back and slide the weight, move the weight toward the coccyx. And move with your own breath. And at the same time, when you do this, watch and observe how your feet are standing. Are they evenly distributed the weight, or you feel the strength more on one foot than another one? So again, everything is even, pressing big toes, rolling in, vacuum in, lifting, coming on the shoulders as high as it feels comfortable. And then again, vertebra at a time, one by one, every inch, every centimeter, evenly. At the same time, lowering down and shifting the weight, lifting the lower back and shifting weight toward the coccyx. So do it a few times. To advance more, to train and mobilize, and slowly you can stand up. For the next exercise, you may require maybe a block, maybe stack of the books, or maybe a yoga block, either a roll yoga block or stack of the books. What we're gonna do, we're gonna work with mobilizing particularly the joints, and you will definitely feel the group of muscles that is weak or ligaments that are stressed or overstretched very much. So what I'm doing now, I am engaging my shoulders, putting my shoulders and my elbows above my wrists. I put with my right knee, I stand on the roller. My left knee is hanging. So I also anchor my right foot. So as I inhale, I'm gonna drop my knee down, maybe not touching the floor. As I exhale, I lift my knee in, and at the same time, as you can see, I'm engaging my core and lifting my left side of the pelvis. Pelvic bone down. Again, knee down. Exhale, roll as much as possible. Up. Again, left knee down, inhale. Exhale, left knee up. Engaging the core, engaging the standing glute area. This is a very good one, stabilizing and training and strengthening all the group muscles that are stabilizing. We call them pelvis stabilizers. Stabilizing the pelvis, stabilizing the SI joint. You can do 2 to 3 reps, 10 to 15 repetitions. You can do 2 to 3 sets, each set of 10 to 15 repetitions on each side. This is also strengthens wonderfully your lower back, your glute muscles, and your legs. So let me see how it will look like from this side. So I'm standing on my left knee on the roller, or maybe stack of the box, so it's hard surface. And again, I drop my left knee. You see my pelvis partially goes down. When I exhale, my right pelvic bone is going up. And again, inhale, knee down. Exhale, I'm engaging the core in, pushing flow away, so I'm not hanging on my shoulders. I'm really pushing the flow away. And again, knee down. Exhale, knee up. Down, and again up. This is one of the most effective exercises to stabilize and strengthen your lower back, your pelvic area, and your pelvis stabilizers. And again, 2 or 3 sets, 10 to 15 repetitions in each set. So this was mobilization part. So we were with the movement, engaging different group of muscles and trying to bring into the balance with the movement, releasing the contraction and tension in one side, and at the same time stabilizing and strengthening the area that is weak or overstretched. We're going to move to another way of stabilizing your pelvic area, and for this you will require a belt. You can use a yoga belt, I will show it in another video, or you can use any scarf, so wrap it up. What you will need to do, you need to find your pelvic bones, right? Here they are. And we put the scarf not in the waist, but we put it much below, lower than your pelvic bones, to kind of squeeze and stabilize the pelvis. So ideally you can do it standing, or slowly you can come down. You can lay down, put it again below your pelvic bones. Exhale, tied it up. So you're trying to bring the pelvic bones as close as possible toward yourself. You can do the knot. Maybe you can ask someone for help. And stabilizing and tightening it up, right? So this is a basic thing that you can do at home if you don't have a specific belt. Otherwise, there are different groups of belts. And here, you can sleep with this belt, you can move around, but what is important is to find the exercise or movement that is uncomfortable. When you are going maybe down, right? Feeling, or maybe when you're going backward, again, feeling how your lower back, how this particular area is moving, and maybe do a bit of movements that will improve stabilization. So next video is about how to train this particular region and how to stabilize even more. And what you can do this practice to reduce the pain or discomfort, and after that slowly you can move toward training the lower back.